Thank you all for being here today. We have Gio here to show us how to access your PROs, which are your surveys on RareX. And it's part of ProMMiS, our natural history study. So PROs are patient-reported outcome, and they are surveys that are asking you questions, your point of view of how your child evolves. As you know, ProMMiS is our natural history study. We have 3 sites. We have CHOP, Colorado, and Stanford. When you go in the clinic, you are going through a bunch of assessments, and there are clinical assessments. And as part of the protocol, there are now 8 surveys that we're asking families to take a week before going into the clinic. So every time you will go to the clinic a week before, you will get an email asking you to take the surveys, and they will be on RareX. And so Gio here with Global Genes / RareX will show you how to access those surveys. So you will no longer see a long list of surveys. We'll narrow it down to 8 to make it really easy for you. And those assessments will really help us understand how you see your child's evolution, how you see what you think about your child overall health and well-being. So I'm here and super excited to have Gio here. Gio and I work together at Citizen. Right before we joined the call, we were talking about how he probably knows Syngap more than a lot of people out here. At Citizen, he was head of clinical operation and was doing the data abstraction and in charge of data delivery. Before that, he was a genetic counselor at the Mayo Clinic and at a Children's Hospital in Minnesota. And he joined Global Genes in June 2024. So Gio's been a great partner and advocate for rare disease and an amazing partner for Syngap. And we're excited to have you here today. So thank you. And the floor is yours.
Thanks, Virginia. It's so good to be here. You know, in my current role at Global Genes, I am technically a project manager. So, like for me, that means I'm very behind the scenes. So when I'm given a chance to like come and connect with patients and families like this, I am very excited. So this is a good day for me. I hope we can learn a few things about what we're trying to do here with RareX and the ProMMiS study. I'm going to start sharing my screen. Let's see, you can see that okay?
Loading. Yep, all good.
Yeah, got it. Okay, awesome. So a couple things here. So first is that I'm sure that we're speaking with people who are kind of at all different parts of the journey here. There are some people who probably are already on RareX and others who are maybe just learning about it or still need a reminder to sign up. So I want to give just a brief highlighted introduction of what RareX is in general, and then shift more towards how we are kind of customizing RareX to fit the ProMMiS study. So overall, RareX is a program that's part of Global Genes, and really it's a data collection program. So it allows us to create and assign different surveys to patients across all kinds of rare diseases. And an important part is that while we are collecting data that is really helpful in natural history studies and in understanding rare diseases, this is certainly not a replacement for other work that's been done. There are so many other sources of data for communities, and we think like at RareX, we are part of that picture and really a customizable piece of that. This slide is just kind of a basic journey of what patients get when they're signing up for RareX. So the platform we use is called the Data Collection Platform, or the DCP. You'll see that abbreviation a couple times. But typically the story goes that RareX has some type of collaboration with a patient community. And after we've kind of signed these agreements, we set up a specific onboarding page where families can come on and create accounts. After enrolling in the DCP, you have to sign a bunch of different forms. So the first is like a Matrix term of use agreement. Matrix is the company that helps us maintain and has built the DCP. And then after doing that, you get a general informed consent document and a data sharing preference survey. So I want to highlight those and we will go over them specifically, but this is kind of part of the process for all patients that are on RareX, not just Syngap patients, not just patients participating in the ProMMiS study, but all patients on RareX. And after that, typically what happens is patients are assigned what we call our head to toe survey. Our head to toe survey is a very high level survey that asks questions broadly about health history. You know, what is your diagnosis? Do you have any problems with neurology or development? Do you have problems with different body systems like heart, kidney, liver, anything? So what the head to toe does is it allows us to narrow in on areas that are affected for an individual patient. I think of it sometimes like one of those nesting dolls, you know, that you like open up the biggest one and there's like lots more inside and it keeps getting more and more specific or more and more small. That is kind of the way that the head to toe works, is it's kind of this introductory survey that asks broad questions that then allows us to assign more specific and detailed surveys around certain phenotypes. So again, that is the way that the data collection platform works for all patients. But importantly, we have the ability to kind of customize this journey as well, which is exactly what we're doing for Syngap and the ProMMiS study. I want to highlight that even though we have this custom journey, kind of both things are happening at the same time. So if you are logging into RareX, you are still going to go through the same enrollment. You're still going to see the head to toe survey. You're still going to see all of those additional surveys assigned. However, what we have done with this customization is we have tried our very best to move all of the ProMMiS surveys to the top of the list, so that even though there may be a long list of other surveys, you know which ones are associated with ProMMiS, you know which ones are most important. And we recognize that survey burden can be a real problem with these natural history studies, and even the 8 surveys that are part of the ProMMiS study, I mean, that can sometimes take a lot of time. So again, we want to emphasize that those are the most important for patients who are participating. All of the others are there. If you have time, if you want to dive into those, that's definitely an option, but not the most important piece. So I will make sure to share this at the end, but this is kind of the launch page that we have for Syngap1 right now. If you are already enrolled, there is just a login button, and if you're just getting started, there is a separate button there for signing up. But again, I'll make sure we share this. I'm going to highlight a couple slides here, and mostly I wanted to make sure that we had a way to record this so that when the questions come up down the road, this can be a resource to look at. But the first kind of important answer that we need people who are participating in the ProMMiS study to address is a very direct question. Are you participating in a natural history study that is partnered with RareX? And this is exactly what the question looks like in the data sharing agreement. If you select yes to that, it will bring up the different natural history studies that we're actively supporting right now, which you'll see second on the list right there is the ProMMiS study. And I want to emphasize this because if you do not complete this part of the data sharing correctly, you won't get access to the ProMMiS study surveys. So this is a pretty important piece. We need to make sure that that's indicated. And then the second piece here is once you answer that question that says you are participating in the ProMMiS study, you are assigned this very specific data sharing survey called the Authorization to Release Health Info. And again, it specifically says Syngap1 ProMMiS Natural History Study there. That is the other kind of critical thing that needs to be completed in order to be assigned the 8 surveys that we're talking about. Okay, I think I'm going to slide over and actually go in and then do an active demo here. So this is just a demo environment. This is all fake information. These are all just accounts that I've created to kind of test things out. But this is very similar to what you'll see when you log in on the RareX platform. The first thing that will come up is if you have multiple patients or multiple children, which I think is impossible, especially because RareX supports so many different diseases. But you will always select your role as a caregiver. Like you are a caregiver answering questions about your child. And then if you have multiple children that are on the platform, they would all be listed here. I want to go down to this test patient that I created. So just as a way to kind of familiarize everyone with what we're looking at, there are two main tabs that are listed under the dashboard. The first is new and in progress. So these are surveys that have been assigned to you that are ready for you to take. And again, a reminder that anything at the top is likely the most important. So in this case, the authorization or least health info for the ProMMiS study is right there and needs to be completed. But you can also look and see if there are different surveys that have already been completed. And for this test case that I did, I do want to bring up this data sharing agreement. This little drop-down menu here allows you to look and see if you want to retake a survey, if you want to email it to yourself, if you want to download it. But we're just going to take a look and view this one. So this is the data sharing agreement. So some general questions are asked in the data sharing agreement. The first is that for any patient on RareX, we have a relatively customizable ability to share data with who you want to share with. So the first question that you're asked is the type of research that you want to participate in. Option one, which is general research, is our broadest research category. So that allows us to share your information with the most possible researchers who are interested in RareX data. We do have the ability to select only health or biomedical research. So that kind of limits it to remove some of these additional other kinds of research. And then further down, we have the ability to limit sharing for only researchers who are pursuing non-commercial purposes. From a RareX kind of data user perspective, a lot of our researchers are academic institutions or nonprofit organizations, but we do have other pharmaceutical partners or other commercial entities that are interested in gaining access to the data as well. So you can make those selections as you see fit. And then the last one is you can limit the research to only researchers who have IRB approved studies. So IRBs are kind of committees that review research studies to make sure that there's no harm being done to the participants. I would say most of our researchers who are accessing data do have active IRBs for their studies, but these are all kind of the different things that you can select when you're signing up. On the second page of the data sharing agreement, we have a number of questions that are kind of talking about other sources of data. So we ask, are you interested in having your medical records connected to your data? This is not something that's available now, but it's something that could be in the future. We have, citizen is listed on here if you're participating and want to be connected. But I'm going to slide down to the most important question again that we talked about. And right here in the middle, are you participating in a natural history study? So again, I can't reiterate this enough. This is the first checkpoint. We have to select yes, you're participating in a natural history study, and yes, that it's the ProMMiS study in order to have the next step that is assigned. So when you complete that, you are then assigned this authorization form. And I'm just going to actually start this survey by clicking the start button there. And all of the surveys that are assigned will have kind of general information. So for this authorization form, it talks about our general study name, which is just the data collection platform. It talks about Zore, our PI, our general contact information. It asks if you will be reading the consent form, or if you're not able to read it, if somebody would be reading it to you. So that's just an aspect of the consent that we always ask. So most people will say no, which means that you are reading it yourself. There's general information about privacy of data. And really what this is saying is that by signing this form, you are allowing us to share your information with the clinical research teams that are associated with the ProMMiS study. And I would really just welcome everybody to read through all these things themselves when they're signing up. But once you select that, you have to print your name as a signature. You have to indicate your relationship to the participant. So in most cases, this will be parent or legal guardian under the age of 18. And then you can complete the survey. Also, if you would like an emailed copy of the survey, this is kind of an option that's available for all the surveys you're completing if you do want to have those on copies. But you'll notice that once you hit complete, and this is hopefully what works, you see that your dashboard starts to change. So right away at the very top, now we have this heading of the Syngap1 ProMMiS Natural History Study. So like I had mentioned before, we want to try to move this to the forefront of your attention. And it lists all 8 of the surveys that are assigned as part of this survey. You know, Virginia, I was looking back at kind of like the contract and the names of the surveys. Like there are slight differences in the way that we call these surveys internally. So I want to assure you that these are the exact same surveys that we had talked about, but I wanted to list them as they are in the dashboard to
Okay.
make sure that there's no confusion there. If you scroll down, you can see all of the other types of surveys still are listed here. But again, in terms of ProMMiS study participation, these are listed further down for a reason. They're not as critical. I'm going to just take a second and change participants here because I have a couple. Let's see, which one do I want? I have a couple different ones. So this is just another kind of test patient where you can see that now there are just 6 surveys listed under here. And that is because if I move over to the completed tab, I can see that a couple of the ProMMiS study surveys have already been completed. And an important piece of this is that if you are just signing up the first time for RareX and you complete your data sharing agreement and you complete your authorization to release information, you automatically be assigned all 8 of the ProMMiS study surveys. However, like Virginia had mentioned, really the critical timing of this is that the researchers want these surveys to be completed within a week of the clinic visit. So in conversations with a lot of the different clinical coordinators, that means plus or minus 1 week. And what we're trying to do is we're trying to notify everybody who has an appointment coming up the next week that these surveys are available for them to take. So we have that ability to kind of recontact people once they're on the platform and once the researchers are able to communicate that information to us. But if you're just signing up for account now, and let's say you have an appointment in a couple months, you're going to be assigned all the surveys. If you ended up taking the surveys early, that would be okay, but really the ideal situation is that you're waiting to take those surveys until the day or the week of the clinic visit. If, for instance, you're in clinic and you accidentally completed one early, there is a way to retake surveys. So again, if you move into the completed tab and you click over on the side here where more options, it does give you the option to retake the survey. So if you accidentally submitted a survey early and you wanted to have to go to revisit and retake it, that is a way to do it. I have the ability, or I would say we at RareX have the ability to also assign these surveys manually. So when we know patients are coming to clinic through our conversations with the researchers, we can make sure that those are manually assigned and they're moved back to your new and in progress tab. The research team knows how to look at these completed versus new surveys and make sure that we're able to retake them as well. So I think we've had a lot of communication recently with the researchers about like how important the timing is, about all the different ways that we can communicate, that we can make sure that surveys are being completed at roughly a week before or after the appointments. It feels like we're all on the same page, but there's kind of just a million different ways that it can happen. And that includes kind of you guys as users on the platform knowing that you have the ability to retake and do all those sorts of things. What questions do y'all have? Virginia, did I skip over something too quickly, or is there anything that would be helpful to walk through?
I think you did a good job, and to reiterate, that's for all 3 sites. So it doesn't matter if you're going to CHOP, to Colorado or Stanford, you will need to do those surveys, and it's at every visit. So the first visit, the 6 months in, and every 6 months, you will get the new batch of surveys.
Yeah, that's right. I would also highlight on the when you see the new and in progress tab, it's not working on this account, but usually I think on the other ones it tells you an estimated time to complete the surveys. So you'll see, and I think if you've taken any of these surveys before, you'll probably remember that some are longer than others. The Vineland, for instance, is one that I think if you've taken it once, you'll never forget it. It takes a little longer than the others, but um, yeah,
That's an
I think
important one.
yeah, it's really important too, which is a little tough, but it does give you an estimate of how long it's going to take to complete. And what I tell people is that sitting down and trying to do these all at once is probably a lot. You can break it up. You can start surveys and come back and complete them later. Like there's all sorts of kind of ways to
Yeah.
complete them at whatever cadence works for you. But if you kind of wait until the last second to do them, you might have maybe a little bit of a long evening completing some surveys. So it's doable, but I would recommend trying to break it up a little bit.
But on the plus side, we went from 18, I think, at first, or like just to down to 8. So we did cut down to what we think is we didn't know how to cut more surveys. Those are all really important because they look at really kind of all the different, communication and violence. It's kind of the whole thing, gastro, um, quality of life. Like they all have different, they all look at different aspects of the patient. So we really tried to cut down to as little surveys that we could. But yeah,
I think
we
y'all did a
couldn't
good
cut
job
down
too
to
of
less.
selecting surveys that are um, like supported across other research initiatives. So it's not like these are
Yes.
random things, but like these are reputable and standardized and like have good metrics across disease communities. So it's really, I think, a
Yeah,
great
and we looked at what's been done in other strong natural history study, what has been not a but what was, the Vineland has been used in some of the clinical trials, like what has been what data set has been, what is the FDA like?
Exactly, exactly. I remember seeing the first list of like 18, and it's like, oh, that's a lot. And it's like, oh, there are
It's a
some in
lot.
there that maybe aren't as good as the others, but I think this
Yeah,
curated list is like pretty exceptional and like super valuable data.
yeah. I mean, nobody likes surveys, but we also, at the end of the day, we are the expert of our own kids and we know them the best. And so, yes, the clinical visits are super important, but that's also giving us the opportunity to answer, to give our opinion and what we see. So that's also really important.
Right. And you think about kind of the old school way natural history studies were done, where it's like you are going to clinic, but then you're being like given paper copies of all of these, and you're
Yep.
completing them like I don't know in your free time while you're busy meeting with all these researchers and specialists. Like I don't know that that's the best way to do it. Um, so at least this gives you a little bit of flexibility to complete it on your own time. I don't know. For me, with young kids too, it's like it's the evening. It's the only free
Yeah.
time I have in my life is those few hours. So
Or when they're at therapy, or when they
oh
are,
yeah,
you're waiting in the car, you have a couple questions you can fill out. Not driving when your car is just stopped somewhere. The other thing that you talked about the consent. Um, Obviously, the broader we're not going to tell you what level of consent to sign. That's to each your own, obviously. But the higher the level you sign, the better, because we can share your data with more people, and that's super important. That's important. Then we can share with more researchers, and then RareX is working is talking with Citizen. They're talking with other platform. They're talking with other researchers. They're talking with pharma partners, and so we want. There's not really a point of filling out of doing all the work if your data cannot be out there. So that's the view. So if you check the general consent and you're doing all the work, then your data is going to be de-identified. I think you share that word. They're not sharing your personal information. It's all de-identified. It's we don't even know who's filling out the surveys. We don't have access. That's why we can't follow up with you. That's why you're probably going to hear from Geo and the team and not from us. So that's where it's important to really read those consents and understanding that the higher the level, the more your data can be shared with other partners and the time that you're putting in is going to really go a long way. So,
We do have our first question. It's from Craig.
oh, yay.
He asks, is this live today? We just completed a clinical visit.
Yes, it is. So the main thing would be if you had just created an account, you would need to make sure that you are updating your data sharing preferences. So again, you would want to be going into your completed tab, clicking on the data sharing agreements, and then clicking the retake button. So that's probably what is the next step. And clicking the retake will then allow you to select, are you participating in a natural history study? Because obviously that question has existed on our data sharing survey for a while, but it hasn't included the ProMMiS study until very recently. So yes, if you went in today, it will be there. It's been live for 3 weeks, I think-ish, 3 or 4 weeks, could that be? So if you created a new count relatively recently, you were probably prompted to do that right away. But if you're a returning customer, we'll say, you need to make sure you go back into that data sharing agreement.
Perfect, thank you.
Thank you, Craig. Looking forward to getting your feedback on all the surveys.
Yeah, Virginia, I was going to say too, when you were talking about kind of like the privacy and like selecting your data sharing preferences, like as someone who is like very, very involved in that process internally, I can say that our privacy around data sharing is incredibly protective of patients. Like our privacy officer is very, very careful about who we are having agreements with for sharing data. It is a very rigorous process to make sure that it's just not anybody who can get access to data, but getting data in hands of researchers and people who we know are going to do good things with it and try to help kind of move the ball forward on treatments and understanding these diseases better. Any other questions?
And quiet bunch. All right. I mean, it's pretty straightforward, which is great.
I think it
Made it
is pretty
easy.
straightforward. Yeah, I think we've also at this point, like we've been supporting the S6BP1 STAR study for around 6 months now. So we've y'all are kind of benefiting from that, is that we've done a lot of the troubleshooting already, and we think we have a pretty good process in place. I'll also make sure I'll share kind of our emails and contact information. So we have a general support email address for our community engagement director. Her name is Caitlin. She's the one that mostly monitors that, but I'll share my email address as well. If people have specific questions, like I'd be happy to help walk through those things or hop on calls and make sure that everybody is getting what they need to get access to those surveys.
Perfect. And we'll post a recording and then include it in the email that will go out with the survey the reminder when they need to go, when they need to fill out the survey.
Okay.
Yeah. Well, thank you, Gio. Appreciate your time.
Yeah, thanks, Virginia. Good to see you all. Let me know if I can help with anything else.